Hi, my name is Viridiana Acevedo, and this is my population health assessment and prevention. Working with the community nurse, I discussed my findings with him, and he agrees with me that the community analysis may be skewed due to a large metropolitan area that is within an hour away from our town, since their analysis said suicide and injury death are more common. We use analysis as evidence rather than find a specific need. Instead, we relied on the surveys and the interviews because they had more similar findings to prioritize the health need. We identified obesity as an issue due to inaccessibility of food and inactivity by residents. The analysis showed that within the county, 40% of adults are obese and 25% do not exercise. We can now validate heart disease, which is the third leading cause of death within the county, as an issue in the community because it can be caused by obesity, poor diet, and physical inactivity, all of which are higher or at the same percentage of prevalence as the state of Texas. The community diagnosis I came up with was risk of heart disease among West Columbia adults related to obesity as evidenced by physical inactivity, inaccessibility to indoor exercise facilities, and lack of food options, because a lot of them had an excuse that it's too hot to go outside, there's too many mosquitoes to work out outside. Possible solutions include community fitness programs, community gardens, and farmers markets. Community fitness programs have been shown to increase retention and physical activity and improve blood pressure, hypertension, and lower the risk of cardiovascular disease compared to control groups who did not participate. Community gardens not only increase fruit and vegetable consumptions, but also lower BMI and increase physical activity. Farmers markets not only bring fresh and local food and to those who don't have time to garden or don't have the land to garden, but also they can also bring cooking demonstrations. One study found that those who shop for fruit and vegetables more frequently at farmers markets tend to purchase a greater variety and have a higher intake of fruit and vegetables than those who do not shop at farmers markets. So my SMART goals are to reduce the percentage of adults classified as obese, BMI higher than 30 in West Columbia by 5% over the next 6 months to help reduce the risk of heart disease. My second one is increase the percentage of adults in West Columbia who consume at least 2 cups of vegetables per day by 25% over the next 6 months in order to reduce the risk of heart disease. Intervention strategies are to work with local physicians or nurses to provide education on heart healthy diets and meal planning, and then to conduct BMI screenings, blood pressure checks, and lifestyle assessment risk at local churches monthly. And I specifically put churches because we have like 16 churches within our town of West Columbia, and they have a good rapport with the residents already. They have a relationship, and they also have buildings. They also have kind of like rec centers attached to the churches that can be used as indoor facilities for exercise, and they can also use the parking lots as farmers market locations if we need to find one. And then community health clinic workers have the medical knowledge, and they also do have the same relationship with a population of the community. And then there's my references.